Hi everyone, welcome back to the Support the Spectrum channel. Have you ever met a person who understands everything but struggles to speak? Maybe they are labeled as low functioning, non-speaking, or even defiant. But what if the real issue is motor planning? What if they know exactly what they want to say, but their body isn't listening to them? Today, we're going to be talking about apraxia, a motor planning disorder that affects the way that someone's brain connects to their body, specifically their mouth. We'll talk a little bit about dyspraxia as well, and how it specifically affects a large portion of the autistic and ADHD community. Okay, first let's get into some definitions. We have apraxia, we have childhood apraxia of speech, we have dyspraxia. So they all are motor conditions. There is a disconnect between the brain and the motor functionings of the body, whether that's in the mouth, or for dyspraxia, it's global, all over the body. And then childhood apraxia of speech is referring to individuals who have apraxia, but they are children 18 and younger. The most important distinction that I want to make first is to let you know that apraxia has nothing to do with weakness. Low tone or weakness in muscles is not the reason why an apraxic person, a person who has apraxia, is struggling to get their words out. A person with apraxia knows what they want to say. It's just that connection from brain to body, it's jumbled, it's delayed, it's disconnected. So that's an important distinction to remember. So this can present in many different ways for apraxic people. Some people who have apraxia just have a certain delay, maybe differences in the rhythm of their voice, certain disruptions in rhythm, maybe a significant gap in between different words, kind of like stutter, stepping. It even can look like a bit of stuttering, but there is a difference, obviously, because it's the motor component. They may appear to be groping for words, and groping in this context means that the mouth might be open. You might see a little bit of tongue movement, you might see a little bit of jaw movement, but ultimately that word is not coming out. And it's not because they don't know what to say, it's because motorically there is a disconnect. Another telltale sign of apraxia or dyspraxia is that groping, but with the external language systems. So verbal groping would be mouth open, little movements, trying to find that motor plan, but groping externally would be if they're using a AAC system, they're kind of hovering around it, or maybe they're touching it, but they're touching all over, not hitting an exact icon. And you think, oh, they're being unintentional, they're not truly using the device how it's meant to be used, but really their motor plan is not set up yet for them to use the fine motor control of hitting a certain icon, and they need to build up that plan to be able to use it on an individual icon basis. So very, very important telltale sign of dyspraxia. Another characteristic of apraxia is inconsistent speech errors, meaning that somebody might say a sentence perfectly with perfect articulatory accuracy, perfect flow, but the next time they say it, they have production errors, whether that is an articulation phonological error or a fluency error. So they're not consistent with the type of errors that they produce. Another telltale sign of someone being apraxic is that they have difficulty imitating sounds. So you ask them to repeat after you, and you can see groping behaviors, you can see changes in fluency, or it just doesn't happen at all. Somebody who has apraxia might answer questions inaccurately because that is the motor movement that is accessible to them at this time. So the first person I want to shout out when we're even talking about apraxia is Jordan at Fighting for My Voice on Instagram. He is an amazing resource for everything to know about apraxia because he is someone who has apraxia and has been training to speak since he was a child. So please go give him a follow. I'll leave his link in the description. And something that he expressed just the other day I saw, He told a story about how he was being asked questions at a nail salon, and someone was asking, "Oh, what's your astrological sign? When's your birthday?" Something about his tattoos. And he wasn't answering the questions accurately. He was just answering, "Yes, February," because those were the words that were accessible to him at the moment. That was the motor plan that was accessible to him in the moment. And so that person, unfortunately, didn't know he had apraxia and just misunderstood and just thought that he was being inaccurate or didn't know or was silly, when in reality it was just because that was what he was able to say in that moment. And that's a very common experience for people with apraxia. That's why if you have someone with apraxia in your life, you want to make sure that they genuinely mean what they say. Because perhaps you ask them a yes or no question and they want to say no, but the only motor plan available to them in that moment is yes. That could cause potential issues and challenges. You should also know that apraxia can affect a plethora of motor movements. It doesn't necessarily have to be speech movements. It can be chewing, certain gestures, facial expressions can be affected as well. Okay, moving more into the prevalence. Apraxia is highly prevalent in the neurodivergent community. Studies are variable. Some research shows that around 60 to 70% of non-speaking autistic children have apraxia. This is huge, right? This really informs our plan of care as speech-language pathologists or caregivers or other educators in neurodivergent people's life. Perhaps there is such a processing delay because of apraxia. Perhaps their inner voice is not matching what they are producing because of apraxia. It could be a motor issue rather than a need for extending processing time or a lack of receptive comprehension. We just have to keep that in mind. Apraxia can also show up in individuals with ADHD or people who have developmental delays, but of course it is so underdiagnosed. But of course, not all non-speaking people have apraxia. It's just very prevalent. Okay, so apraxia again is really focusing in on those facial muscles, larynx, inner mouth, oral structures. But let's talk about dyspraxia. Dyspraxia is a more global experience. It affects the coordination of fine motor skills, gross motor skills, all over the body, not just in this local region in your body. So often very co-occurring with apraxia, but not necessarily they have to be co-occurring. Somebody can strictly have apraxia and not have dyspraxia, but a lot of people who have discoordination with their oral motor movements also have discoordination with the rest of their body as well. Usually PT or OT services target dyspraxia, and they will work on things like tying shoes or staying balanced, coordinating arm movements and leg movements, kicking, throwing. It can be very active and fun therapy for dyspraxic people, but it's something to keep an eye out for if you are a speech therapist or caregiver or anyone supporting neurodivergent people, is that if you see discoordination or uncoordinated movements in a client or loved one, you might consider getting a dyspraxia diagnosis and getting them into treatment services. For some reason, there is a lack of a dyspraxia diagnosis in the US compared to other countries, like in the UK. There is such an underdiagnosis for it, and I'm not sure why, considering there is a high prevalence of it within the neurodivergent community specifically. I think a lot of times professionals will attempt to attribute certain characteristics as something else, as general clumsiness, or because they need more processing time, or a bunch of other reasons, right? But I'm hopeful that we can increase the amount of recognition this disorder gets so that we can really help them and pick the appropriate approaches to help these people. May is actually Apraxia Awareness Month, and today is actually Apraxia Awareness Day, but I know this video won't come out for another 2 weeks or so, so it might be June when it comes out. But just so you know, May is for apraxia awareness. Whenever I am giving presentations about neurodivergence generally, I always make sure to include a section about apraxia and dyspraxia to help people understand how frustrating it must be to have a body that doesn't listen to your brain, and to really help people put that into context of what that means. So this person has an inner voice that is so strong and rich and deep, and they aren't able to express their inner minds verbally or through AAC systems. Remember, dyspraxia can affect the fine motor control and movement, and we really have to accommodate for that. And we really have to sympathize, you know? There is this feeling that there is a barrier between brain and body, and it is also physically exhausting to work against this. So somebody who is apraxic and all day they have to really intentionally try to produce these motor movements that are hard for them, by the end of the day, they are exhausted. If they're having an especially stressful day, it's even harder to get that motor plan down. So please be aware and have patience. It can certainly lead to a shutdown of communication in general. I actually have a client right now who most likely is apraxic. I've just started seeing them, and they haven't used their voice since before puberty, and now they are in adolescence. And so it's been years. It's been years since they've used their voice. But they've expressed to me that they want to use their voice, that they don't really want to use a communication system or use AAC. They want to use their voice. But imagine how hard that is to build up the strength to do that when it's been so long that your muscles have not been performing that motor plan. Of course, we're working on it. We're taking the approach actually of trying to imitate some preferred sounds to really get some concrete buy-in. This learner loves animal sounds and also bodily sounds, and so we're just starting off with some more breath support and sound to kind of dip our toe in the water. But even so, I've been working with them for 3 weeks now, and they haven't tried yet. So this could be an emotional component because it is very emotional for them to try to use their voice. They obviously have shut down and avoided using their voice for so many years. And if this mirrors someone in your life, please do not give up on them. If they have that goal, make sure that you're patient, make sure you're sitting with them. If there's some days that they really just don't want to try, know that it might be because they're especially tired or exhausted, or that motor plan just seems so out of reach for them. But it's not. Stay consistent and stay kind. Okay, now I want to get into some myths and misconceptions about apraxia and dyspraxia. One of them is they'll talk when they're ready. No, we need targeted treatment to address motor planning needs, and we need to give them access to AAC. Now, not every person is wanting AAC, right? There's plenty of people who are apraxic, who have this rich inner mind, who do not want to rely on communication systems. And while that is their choice, we still want to give it to them so that they have robust language accessible to them if they really need it. Certainly, there are going to be moments when they want to express themselves and they just can't, and they have to rely on their systems, and that's okay. Another myth, they just need to practice more. Repetition can be important, but repetition is not the only thing they need. They need distinct and individualized motor plan implementation strategies to help them through the process of building up motor plans. And this is very challenging. This takes a lot of time, and it is truly individualized to the person. Let's touch on a few apraxia protocols, a few different programs to target apraxia of speech. The first one we'll talk about is DTTC. This stands for Dynamic Temporal and Tactile Cueing. And this approach is specifically for childhood apraxia of speech, so it would be for children with apraxia. It has a lot to do with the hierarchy of supports and fading cues, and there's a lot of research to support this method. Another similar one is the NDP3, the Nuffield Dyspraxia Program, and it's very similar. Targets CAS, focuses on those motor plans, lots of research to support it. Another one is the Rapid Syllable Transition Treatment, or REST, also for CAS, has a lot more targeting on prosody and rhythm of voice, and is very helpful for certain learners. The next one I want to talk about is prompts for restructuring oral muscular phonetic targets. Prompt, though, is a technique that uses a lot of touching and guiding learners. It is for CAS, it is for dysarthria, it is for other motor speech diagnoses as well. But this one can be a bit invasive. There is plenty of research to support it. It is helpful, but just so you know, for some people, it might impede on bodily autonomy. So some people do not like to be touched as much as prompt encourages the clinician to touch them. And then the last one we'll talk about today is the Kaufman speech-language protocol, speech-to-language protocol. This is the one that I am most familiar with, this one and DTTC. These are the ones that I tend to use the most. And sometimes REST, depending on the learner. I find that Gestalt language processors really like REST because it does work on prosody, it does work on nonsensical words. So these three approaches are the ones that I'm most familiar with, I would recommend, but it just depends on what your learner needs. Okay, going back to the myths. One myth is if they can make sounds, they can talk. This is because apraxia has a lot to do with inconsistency. Sometimes you're able to access a motor plan and sometimes you're not. So you really need to know that just because someone can make a certain sound one day doesn't mean they'll be able to access it and make it the next day. So don't put too much pressure on them saying like, see, you can do it, because it doesn't work the same every day, especially when you're in different emotional states. And the next one is just important across the board. We could speak about this in any video that we make, and it is that non-speaking means no intelligence or low intelligence. Oh my goodness, this couldn't be any less true. Someone who is non-speaking most likely can receptively understand way more than people think, and their inner minds are rich, deep, knowledgeable, and they want to express it so badly. And that is something that I think about daily and really a huge motivator for me. I tell all my clients, I really want to help you get your inner voice out, because I know you're communicating to me in your inner voice. I just can't hear it yet. And one of the last things we'll talk about today is how do we provide treatment services in a neurodiversity affirming way for apraxic and dyspraxic individuals. And the first thing we're going to do is provide them with an AAC system that is robust, that has as much age-appropriate vocabulary as possible, and has access to a keyboard. A large population of apraxic and dyspraxic individuals enjoy text-to-speech communication. They enjoy typing their words rather than using AAC icons or different pictures and images. And whatever works best for them and works with their motor plan is what we are going to do. So make sure they always have access to a keyboard. Number 2 is we presume competence. We presume that that person has a rich inner mind, that they understand us, that they are going to use the tools that they can to communicate with us. And at the same time, we confirm that they are saying what they mean to say. Number 3 is that we use multimodal strategies to help them. We use visual sign, we use verbal cues, we use kinesthetic cues if they are open to it. We use typing, we use communication boards. We do anything we can to help them express themselves and to model certain motor plans or communication behaviors. And we need to individualize our care as much as possible. So Like I said in the first one, AAC should be robust. It should be filled with as much age-appropriate vocabulary as possible, but the actual format of their device may appear different than the traditional large screen display that has, 20 to 30 icons on the homepage. Perhaps for someone with dyspraxia, they may need bigger icons, might not require as much on their homepage because it is hard for them to have the fine motor skills to touch really tiny icons, and will have a better ability to use those icons if they are a little bit larger. And number 4, and this is important, you want to be as collaborative with your clients as possible. Maybe they are not feeling doing motor planning drills that day. Maybe drills are not what's best for them. Maybe you try the DTTC, but it's not working and you need to go to rest. And maybe rest isn't working and you need to go to prompt. Maybe then you need to transition to Kaufman. You have to be willing to be adaptable to the client and what they need, what supports they feel that they need. So that is always a big component of neurodiversity affirming care, is making sure that we're creating goals with the language learner in mind. Okay, thank you guys so much for listening. We talked about definitions today. We talked about how to determine if somebody has apraxia or dyspraxia or CAS. We talked about the different programs that we use to target this treatment. We talked about myths and misconceptions, and we talked about how to perform therapy in the neurodiversity affirming way. So what I will leave you with is, next time that you are observing a certain behavior, think to yourself, is this a motor planning difficulty? Could this be contributed to a motor planning disorder? Because perhaps it is. Remember that this diagnosis is so crazy underdiagnosed. So make sure you keep an eye out if you are a neurodivergent support advocate or speech therapist or whomever. And thank you so much for watching. I really appreciate you making it to the end of the video. If somebody needs to hear this information, please share this video with them. Do not forget to like and subscribe, and I will see you in the next one.